Deputy Minister of Health, Associate Professor Dr. Phouthone Muongpak, unveiled at a daily media briefing recently that the government is rolling out 3 specific approaches to prevent the spread of COVID-19, namely the lockdown of Vientiane, tracking of new cases, and requiring everyone to comply with preventative measures, such as the wearing of face masks, social distancing, hand washing, and getting vaccinated.
ในการนำใช้3 ยุทธวิธีสู้รบเพื่อปิดล้อมบ่ให้เชื้อพยาธินั้นออกไปข้างนอก
The 3-pronged approach, namely the lockdown of Vientiane, tracking of new cases, and requiring everyone to comply with preventive measures such as the wearing of face masks, social distancing, hand washing, and getting vaccinated, was outlined by Deputy Minister of Health, Associate Professor Dr. Phouthone Muongpak.
ปราบพยาธิฆ่าเชื้อกู้เอาชีวิตของคนเจ็บผู้ติดเชื้อนั้นและก็กันบ่ให้มีการติดเชื้อใส่ผู้อื่นเพิ่มขึ้นอีก
He said the lockdown in Vientiane became essential after numerous people contracted the virus and it began to spread rapidly. The lockdown was aimed at stopping the spread of the virus until it was contained, he said, and was intended to ensure that no one entered or left Vientiane, especially people attempting to enter illegally. The second approach is to identify and test all those at risk of contracting the virus, to quarantine certain individuals, and provide treatment for those who are unwell.
เข้มงวดในการจัดตั้งปฏิบัติมาตรการ
Associate Professor Dr. Phouthone said the third approach to tackling the spread of the virus is aimed at preventing people from meeting up and from transmitting the virus to others through compliance with hygiene measures as well as being vaccinated. The number of people contracting COVID-19 in Vientiane continues to increase and more cases surfaced in the provinces of Champasak, Savannakhet, Sekong, Bokeo, Udomsai, Longpabang, Phongsali, Sayaburi, and Vientiane. Everyone is urged to be on their guard to stay at home and avoid meeting up with other people.
นอกจากได้เตรียมความพร้อมของโรงหมอที่มีอยู่แล้วนี้
The Ministry of Health and other government bodies are setting up makeshift hospitals in various parts of Vientiane to ensure that everyone infected with COVID-19 has access to health care. Mitapap Hospital, Mahosot, and 103 Hospital will be used to treat those who need specialized care in intensive care units. The Health Ministry has asked all hospitals to increase their intensive care capacity to prepare for a possible rise in more severe cases. The government will begin using temporary facilities to accommodate patients when hospitals become full. The goal is to provide an extra 500 beds. The 2 temporary hospitals are planned at the Lansang Indoor Stadium in Donggoi Village and at the Lao Football Federation in Hoi Hong Village. Authorities are also considering a plan for patients with mild or no symptoms to be accommodated in quarantine centers.